In this video, we're going to be taking a look at ethics involving genetic choices and genetic information. So we can start by posing a question that will point us toward a certain kind of case. So is a physician ever obligated to inform family members of a patient who has tested positive for hereditary disease, even though it would break confidentiality? So imagine a kind of case, just to make this more concrete. A patient named Maria has been diagnosed with Wilson's disease. This means that each of her siblings has a 1 in 4 chance of carrying this disease. Now, most would probably say Maria should inform her siblings of this. That's the right thing to do on Maria's part. But for whatever reason, Maria doesn't want anyone to know that she has the disease. So in this kind of case, does the physician have some sort of obligation? Is it the right thing for the physician to do to inform Maria's siblings that they may have this disease and they should get tested and so on? So the consideration in favor of telling Maria's siblings is the principle of non-maleficence. So the physician says, do no harm or benefit patients. That's the principle of beneficence. And so that suggests that the physician should tell Maria's siblings. Now, there's one thing that's to consider here, which is that are Maria's siblings the physician's patients? And that matters. If the siblings are not the physician's patients, that may change things. But in any case here, the standard response among ethicists is that the physician should not tell Maria's siblings because that would break patient-physician confidentiality. And the whole point here really is, I would say, twofold. One reason being you need to respect Maria's autonomy, which means respecting her privacy. And if she says don't tell, then you shouldn't tell. But also kind of taking a step back, it's important for physicians and healthcare professionals to maintain trust, public trust in the medical profession. And maintaining this patient-physician confidentiality is a way of ensuring that trust is maintained between physician and patient. Another question that arises in this area is a physician obligated to inform a patient, their own patient, that they have a risk for an unpreventable, say, untreatable disease if that patient is unaware? So this raises issues about whether or not patients have a right not to know certain information about their own health. So, for example, there may be a patient that communicates to the physician directly or indirectly that they don't want to know if they have a certain condition, like cancer or something like that. They just don't want to know. So is the physician obligated to abide by that, or should the physician nevertheless still inform the patient? So we have those two different choices that we could make. And when we apply the principles of medical ethics, you'll see it pulled in different directions. So autonomy would suggest that the principle of autonomy would say that you should, if the patient doesn't want to know, then you shouldn't tell the patient. Otherwise, you're being overly paternalistic toward the patient. You might say they have a right not to know for whatever reason, and you should respect that right. The principle of beneficence would say, well, it may be if the physician really thinks it's for the patient's own good to know whether the patient wants it or not, then the physician should tell the patient so that the patient can make necessary arrangements or whatever. Now, I'm not sure what the standard response here would be. This is actually a pretty new issue. But even if you're going by the principle of beneficence, you also have to consider, if the patient doesn't want to know and you tell them anyway, is that actually going to do them more harm than good? Is it going to give the patient a heart attack or create undue amounts of stress? So this is actually kind of a newer issue that I've seen in medical ethics, which is, again, whether there's a right not to know among patients. Okay, so let's shift gears a little bit and discuss reproductive decisions. Okay, we can start this issue by raising another question. So would it be wrong not to prevent devastating diseases or disabilities in a child if prenatal genetic testing revealed that the future child would be afflicted by these diseases? Would it be wrong not to prevent it, or is it permissible to prevent these devastating diseases? And so the basic scenario here is the patient gets genetic screening, say in the first trimester, and the results are that the fetus has the gene for some sort of disability or some sort of disease. This could be blindness, deafness, spina bifida, the whole range. So the question here is there anything wrong with terminating the pregnancy in order to not have this future child with this disease or disability? Now, the answer to this question may depend on, well, what is the disease or disability? How disabling and how much suffering would it cause the future child? So, for example, deafness is considered a disability, but one can live a fine life, a fulfilling life of being deaf. So that's different, say, from spina bifida, which is much, much more severe. And so it may depend on the severity of the disability about whether or not it would be okay or morally permissible to have an abortion because of this reason. So if you think abortion is wrong, period, then it'll be wrong no matter what the reason. But the question here is would it be wrong to terminate the pregnancy, to have an abortion for this reason, to prevent a child from coming into existence with whatever disability? And the parents could have many reasons for doing this. I suspect the most common reason would be that it would be maybe the parents don't feel like they have the resources necessary to raise a child with a certain kind of disability. So there's a couple different stances you could take on this. So one would be to say it would not be better for the future child in cases of selective abortion, since the future child would not exist. So this is basically saying that it would be wrong to prevent the future child from existing by terminating the fetus, because only in cases in which the existence of the future child is better than the non-existence. So let's take the case of spina bifida. It's a pretty debilitating disease. Life expectancy has increased over the years. And one could argue that a life with spina bifida is better than no life at all. The existence is better than no existence at all. And if that's the case, then it could be wrong to prevent that future person from existing. This is related to the non-identity problem. And the non-identity problem basically says that this action that seems like you're harming the future person, say, getting an abortion and then the future person doesn't exist, it seems like you're harming them, or even say like smoking during pregnancy will harm the future child, and so on. That thing that's supposed to be harming is actually a condition for the existence of the future person. And so you can't harm them by doing X if X is necessary for the person to exist. So that's a bit of the non-identity problem can make your head spin a little bit, but I do have a video in the module about it that explains it in more detail. Okay, so much for this point. Another argument that's been given against terminating a fetus in order to prevent the child being born with disabilities is that in doing this, you are disrespecting and discriminating against people with disabilities. So in doing this, say you terminate the pregnancy because the child has a gene for blindness, and so in terminating the pregnancy because you don't want to have a blind child amounts to discriminating against blind people or disrespecting blind people. Now, one response to this is that, well, in doing this, no rights are violated, and testing does not entail attitudes of contempt or condescension, condescending attitudes toward the group. So as long as no rights are violated, then there's nothing wrong with it. There's another interesting response to this. So let's take a more specific kind of case. So a parent or the fetus is tested and has the gene for deafness. Is there anything wrong with terminating that pregnancy for that reason, because the parents don't want to have a child that's deaf? The deaf community, many of them has said it would be wrong because that amounts to disrespecting the deaf community, deaf people, or something like that. One argument against this in reply goes something like this. So the first premise to this reply is the crucial one, and it's saying this: if it's wrong to try to avoid having a disabled child, then it's at least permissible to cause your future child to be disabled. Say, for example, you could take a pill that will cause the fetus to develop, say, deafness or blindness. So if it's wrong to try to avoid having, say, a deaf child, then it should be permissible to cause your future child to become deaf by, say, taking a pill that will alter the genes or whatever in the fetus. That's not permissible, therefore it's not wrong to try to have a disabled child. So I thought this was an interesting little argument, so that's why I put it in here. Another related issue that I have a video in the module about is whether it's wrong to intentionally choose for disability. So is there anything wrong, for example, with, and this may depend on the disability, of course, but is there anything wrong with, say, a deaf couple who genetically selects for deafness so that they can have a deaf child? And again, whether it's wrong to do this or not may depend on the severity of the disability or the severity of the disease. Okay, so switching gears once again, I want to talk a little bit about the ethics of gene therapy, the ethics of genetic selection or eugenics. So gene therapy, just sort of broadly, loosely speaking, genetic engineering, it's the manipulation of genetic material to prevent or to treat disease, hence the word therapy here. And there's a couple different kinds. Somatic gene cell therapy is where genetic alterations are not inheritable, germline, and zygote gene therapy are when the genetic alterations are inheritable. So those are two different kinds of gene therapy. Generally, it's thought that genetic or germline therapy is not morally acceptable because it's too risky, since those gene alterations can be inherited. If you mess up, you could, that there could be really some long-term negative consequences of that. So somatic gene cell therapy is much less controversial than germline. Just some terminology here. Eugenics. Now, eugenics has negative connotations, but strictly speaking, technically, eugenics refers to the deliberate attempt to improve the genetic makeup of humans by manipulating reproduction in some kind of way. We've done this with farm animals. Humans did this with farm animals for hundreds and hundreds of years to manipulate them their genes in order to have like a docile animal. So eugenics can be done in that kind of way, or it could be done in direct gene alterations through like CRISPR technology or something like that. So eugenics is not necessarily a bad thing. It's going to depend on what kind of eugenics you're talking about. So let's talk about some different kinds of eugenics. So in the literature, one kind of genetics is liberal eugenics, and liberal is used just in this sort of broad term referring to liberty. So liberal eugenics is leaving genetic decisions up to individual choices. So this would say if a couple wants to do IVF and they have a number of fertilized eggs there, they should be free to choose whichever one they want to implant based off of the genetic makeup. So that's liberal eugenics. Negative eugenics is eugenics for the purpose of preventing or treating diseases. So there could be negative liberal eugenics. So negative eugenics is, you could think of it also as therapeutic eugenics. So for example, if a couple does IVF, they have a bunch of fertilized eggs and they choose this one rather than that one because that one has a gene for a disease, that would be an example of negative liberal eugenics. So not as controversial as other forms of eugenics. Positive eugenics is, say, genetic selection, for example, for the purpose of improving functions beyond normal levels, or whatever is considered normal at the time. This also is understood as eugenics for enhancement purposes. So say, for example, we have that similar case in which a couple is doing IVF, but they pick the fertilized egg, the zygote, because it has a gene for like higher intelligence, higher than average intelligence, something like that. That would be liberal positive eugenics. That's way more controversial than negative eugenics or negative or therapeutic genetics for therapeutic purposes. Now there's other forms of eugenics like illiberal eugenics, which is what we kind of usually think of with eugenics, where the government's like forcing people to have babies or like killing any babies with disabilities or something like that. I don't even put that up here because that's obviously wrong. It's kind of beyond debate. But what I want to talk about now is positive eugenics versus negative eugenics. And again, eugenics, it does have this negative connotation, but all we mean here is a kind of genetic selection. That's all we mean here. And that can be done through literally selecting a zygote over another zygote in the case of IVF, or it can involve direct genetic engineering, say using CRISPR technology, where you're actually going in and changing the genes. So some have argued that negative eugenics, or eugenics for therapeutic purposes, is right, or at least there's nothing wrong with it, but positive eugenics is not permissible, that there's something wrong with this. I'll give you an example. So a philosopher named Michael Sandel talks about how negative or positive eugenics is wrong because it will lead to us regarding our children as like these objects of design. So an example of positive eugenics would be designer babies. You're choosing all the different features of your baby using genetic engineering. And Sandel argues that this is wrong for a number of reasons. The main reason I would say really being that you stop to sort of, people are going to stop valuing their children for their own sake and start seeing their children as like these projects or like these objects of our design. And that can sort of undermine the humanity of the child. And embracing positive eugenics and say designer babies will sort of prevent us from accepting the gifted character of our capacities and abilities. So that's one argument against positive eugenics. If you Google Michael Sandel eugenics or genetic engineering, there's some interviews with him where he explains this that are pretty good. Others argue, contrary to this, that there's actually no moral difference between negative and positive eugenics. So just to quote John Harris, philosopher John Harris, he says there's no moral difference between attempts to cure dysfunction and attempts to enhance function, where the enhancement protects life and protects health. So you could have an enhancement that, for example, makes the person's immune system really good, like above average good, or their ability to heal themselves really good, like Wolverine. And he says, Harris says, that's a positive, or that's a positive enhancement, genetic enhancement, because it goes beyond what's normal. But there's nothing wrong. There's no moral difference between that and say genetic engineering to prevent a disease or something like that. Now, one issue that this raises is that the standard of what's considered normal health has changed drastically over time. The standard of normal health is historically relative. The standard has increased. So why not just keep increasing it? We've been doing that for so long. So you might say that over the course of medical history, there's always this nudge toward enhancement. And that explains why the standard of normal health has gone up, has increased, and with the advancement of medical technology. So that's something that favors John Harris's point that since there's no moral difference between negative and positive eugenics, if negative eugenics is okay, then positive eugenics is okay. Well, I want to end with one more issue related to this, which is whether or not it's actually morally obligatory to enhance, so engage in some sort of positive eugenics or just biological enhancement in general, whether there's actually not just permissible, but that's the right thing to do. You should do it. And a philosopher named Julian Savulescu has argued that in many cases, there's conditions, but under certain conditions, it's right to enhance health. It's right to, for example, engage in positive eugenics. So he wrote a paper on this, and I want to give you a thought experiment, an argument, one that comes from this paper. So imagine this. So imagine that there's a cheap supplement that would make a child smarter, say above average. Right now it just comes out. It's like a Flintstones vitamin. It's really cheap. It's like $5 a bottle or something like that. Super cheap. But this child's parents just are too lazy to give it to him. They just don't really care, and so they don't give it to him. If these parents are in the wrong by not giving the child this supplement that would greatly increase the child's intelligence to way above average, then it would also be wrong not to genetically enhance intelligence, right? So the conditions here would be that it's cheap, it's affordable, just like the supplement, it's safe, just like the supplement. So we're packing in these reasonable conditions here. But assuming it's safe, it's affordable, it would be wrong not to genetically enhance intelligence, say. For the same reason, it would be wrong for not giving the child a cheap dietary supplement. Now, when asking students, so I'm pretty sympathetic with this, but when asking students, a lot of students say there would be nothing wrong with their parents not giving the child this supplement. So a lot of this just depends on your intuition here with this case. But just to kind of motivate why it might be wrong, first of all, it's pretty much no burden on the parents to do this. And if the parents did do this, it would greatly benefit the child. It would expand the child's opportunities to live a good life. And you might say, parents have an obligation to do that for their children, to try it, as long as it's not super burdensome or too burdensome. The parent has an obligation to try to give the child opportunities to live a good life. And this is one way to do it that's pretty much zero burden. So then it would be wrong for them not to do it. Now, the way to argue against this here, that it would then therefore be wrong not to genetically enhance the child. The way to try to argue against this, if you accept the intuition that it would be wrong to not give the child the supplement, is to try to find any morally relevant difference between the two. So is there a morally relevant difference between giving the child this cheap supplement and genetically enhance the child such that it's right to give the child the supplement but wrong to genetically enhance? And some might say, well, one difference is that with genetic enhancement, you're talking about genetic material, and there's something special about that. It's biological, it's part of somebody's identity or something, I don't know. And that makes some sort of moral difference between that and the pill, giving the child a cheap supplement. Now, Cebulescu's response to this is that it's actually not a morally relevant difference, because parents do things to their children all the time for the children's benefit that affects their biology and that affects their genes. What you feed a child on a day-to-day basis affects the child's genes, for example. If you feed the child a really horrible diet, it's going to have a negative effect on their genes. This is part of epigenetics. And so it is, I would say, quite difficult to find a morally relevant difference between those two cases. And I would say that the common answer to why it might be wrong, or a stronger answer for why it might be wrong to genetically enhance, is it could come with certain risks that we don't know about. And Cebulescu himself would say, well, yeah, I mean, if it was too risky, then obviously we shouldn't do it. Okay, so that's it for this video. We started by looking at the ethics of informing a patient's family members if the patient has a disease that's heritable. And the standard answer here is that the physician should not do that because, among other reasons, it would undermine patient-physician confidentiality and trust. That's really important to maintain public trust in the medical profession. And that's one of the main reasons why confidentiality is important. Then we looked at whether or not there is a right not to know. That one's more controversial, I would say. But if you're going by the principle of autonomy and respecting the patient, then you should respect their request not to know. Now, there's a lot going on in the context here and in the situation. So just keep those in mind. The details of the situations matter. And then we looked at the ethics of gene selection, whether it would be wrong to terminate a pregnancy for the purposes of not having a disabled child, and then we looked at whether it's permissible to intentionally choose for disability. And then we looked at negative and positive eugenics.